Dr. Anand Raman, Dr. Deepchan, Dr. Sundar, and all the cardiology teachers and professors and delegates. A very good evening to you all. First of all, I warmly thank Dr. Kerian sir, who has come in traditional attire on his grandson's birthday. Thank you very much, sir. Thank you. And I thank Dr. Anand Raman for reminding me that I'm a practicing orthopedic surgeon and a gold medalist in orthopedic surgery. So what I'm doing in a cardiology conference. So one thing I realized in the short session I attended here, seeing all the accomplished cardiologists performing the procedures, I would have never become a good cardiologist, that's for sure. I went to UK in 1995 to learn certain simple things like a total knee replacement and arthroscopy, which was not common in India at that point of time, in late 1990s. But down the now in 20-25 years, the advancements in orthopedic surgery have not been significant. In the last at least 5 to 7 years, I can see the joint replacements or arthroscopic surgeries, the choice of implants technique, except for the possible benefit from the robotic knee replacement. All the things have been standardized. But every time when I look at a cardiology procedure, which is happening in Kauvery Hospital, I'm amazed, baffled many times. How much advancement to the significant scientific improvements happening in cardiac sciences. I was speaking to Dr. Sandeep briefly, who has come from Birmingham. So I asked him, is there anything that you do in United Kingdom that we are not doing in here in Chennai? He told, no, you do much more than what we do in UK. So we are, as far as this Kauvery Hospital group is concerned, we started as a small 30-bedded setup in 1999 in Trichy. And then we have grown to now 2,500-bedded hospital group with 11 hospitals spread across 8 locations. Thank you. Since the beginning itself, 2003 or 4, the cardiac sciences have been the number one primary super specialty departments in the cardiac group. I deliberately underplayed my own orthopedic surgery, which is department also, because I know that the cardiac sciences is going to play the major role in our hospitals group. So when we started this Heart City, the exclusive 100-bedded the Heart Hospital in Trichy, that was the first private hospital in South India to offer the comprehensive cardiac services. And we were the first one to do the open cardiac surgery in Trichy at that point of time. Of course, from them, we have moved on, and after coming to Chennai, you tell me what we don't have, from hybrid cath lab to Impella to laser, and then now heart and lung transplant and assisted devices. And we were able to create this infrastructure purely because of the confidence that we had in the cardiac experts. That's why we were able to attract the top international talented specialists at Dr. Kumar Detal. Thank you very much, sir. So it is not just a technology or infrastructure. Anybody has money, they can invest in all this. But it is the cardiac experts who are driving the excellence in Kauvery. There's no doubt about that. There's technology or the equipment not in the right hands is not good for the patient. So we are very, very fortunate, blessed to have all the top specialists performing the most advanced and complex cardiac procedures in this part of the world, which is on par and better than many international reputed centers. Thank you. And as far as this International Cardiac Conclave is concerned, I would like this to become, my request to all the course directors, that this should become a landmark event in the cardiac sciences. And not only an annual event, this has my wish is that this is a platform for an ongoing collaboration where the specialists from all the hospitals, national and international, share their expertise. So we learn from each other. So that is my sincere wish. I'm sure I'm confident that we have got the resolve and determination to take it to the highest level possible. And I wish this International Cardiology Conference a grand success. I'm proud to launch the Heart Institute as well. Thank you.
First of all, I must say that it's a distinct privilege for me to be here to take part in this international conference. Thank you. Especially Anand has been my colleague for a long time. Others, I was just recalling because I think I am losing memory. The reason is I am in the process of writing my autobiography. This next March I will be completing 82. And so, unfortunately, I have got little memory. So I remember a lot of things from my 4 years of age. I can very boldly say, I never thought about these things. That I am one of the few fellows who have seen the history. And there has been a part of it. Because, I come from an agricultural family, small town. But I still remember 1947. Everybody was up and they were all in the small street, in a small road. And I didn't know what was happening. There was, the church bell tolling, the temples, the mosque, all the people were making a lot of noise. So I was asking, what is happening, what is that? They said, we got independence. I didn't know what was independence at the age of 4. So then later on, 1948, I think it was February, they said the Prime Minister of India is coming. Because everybody goes up to Cape Town. And the road which has to go is in front of our house. So I saw Pandit Jawaharlal in an open jeep going, wishing everybody as Prime Minister of India, first Prime Minister. So I could see that also. I think in 1949, Mahatma Gandhi was shot, and his ashes were taken to again to Cape Kauvery for immersion. So I saw that also. So, birth of India, independence, and then first Prime Minister, Mahatma Gandhi's assassination. But I never realized that I will have one more chance. That is 1981, December 23rd, I was in Moscow. I was invited to go to the Conclave Art and Conclave Institute. And so I was staying in Hilton. The professor of cardiac surgery was Bhakrat Alwarpet. So he and his wife told me, have you seen a ballet? Ballet? I said, no. He said, I think. So I went with them. I saw the ballet. There was a restaurant. The restaurant had some food. While coming back, they brought me in the hotel. The room. When I went to the room, within 1 minute I got a call. And those old phones with the rotatory dial. And that had a green bulb and a red bulb. So this red bulb was going on. So I didn't know what was it. I picked up the phone. So the receptionist said, please lock your room. So naturally I went and locked my room. He said, don't get out of the room. If you want to see something strange, you can, but switch off your room light. through the window. When I looked through the window, what I saw was Hilton, where I was staying. Just opposite to that is the White House. White House, not of the President of America, but White House President of the USSR. So within a minute I would see about almost 1,000 people coming out holding white kerchief up, like this surrender. And immediately after that, a couple of choppers, and that was the dissolvement of USSR. So I would say dissolvement of USSR and formation of Russia. I mean, the Soviet Union. Gorbachev left, and so I had the opportunity to see all these. So this all came to my mind only because I am writing the autobiography. So this also will stay in my mind. Thank you for the opportunity.